With respect to Phase 1, Massachusetts, in partnership with our Vaccine Advisory Group and healthcare providers, has developed a COVID-19 vaccine distribution timeline that's been accepted by the federal government. It was pulled from frameworks that were developed by public health experts, the Center for Disease Control, and the National Academy of Sciences, Engineering, and Medicine. The vaccine will be distributed in phases, starting with our highest risk and highest need individuals. Phase 1, in order of priority, is clinical and non-clinical healthcare workers doing direct and COVID-facing care. Long-term care facilities, rest homes, and assisted living facilities. Police, fire, and emergency medical services. Congregate care settings, including shelters and corrections. Home-based healthcare workers and healthcare workers doing non-COVID-facing care. Clinical and non-clinical healthcare workers doing direct care and COVID-facing care are at the highest risk for COVID-19 exposure due to what they do every day. Providing this group with the vaccine first will protect them from exposure and ensure that they can continue to provide health care to others safely. Then vaccines will be distributed to our most vulnerable residents, and this includes residents who live in long-term care, rest homes, assisted living facilities, and the staff who work in those settings. The elderly, as we all know, are prone to becoming gravely ill from COVID-19. And this is sadly true for congregate care settings where infection is more likely to spread. Next will be first responders, including police, fire, and emergency medical services. Then individuals in congregate care settings, including correction facilities and homeless shelters and the staff who work there. And then finally, in Phase 1, vaccines will be made available to home-based healthcare workers and healthcare workers doing non-COVID-facing care. And you can learn more about Phase 1 by visiting the state's website at mass.gov/COVID vaccine. The federal government has informed us that we should receive 300,000 first doses by the end of December. On Friday, we placed an order for 60,000 first doses of this allocation, which is expected to arrive in Massachusetts on December 15th. The breakdown of the 300,000 doses in allocation will go to the following groups: 164,000 first doses to clinical and non-clinical healthcare workers doing direct and COVID-facing care, 64,000 first doses to first responders, and just about 102,000 first doses to congregate care residents and staff. This shipment should contain doses from both Moderna and Pfizer, pending FDA authorization. Massachusetts won't distribute a vaccine until it receives FDA authorization for emergency use. This shipment will be directly distributed to 32 hospitals that provide geographic coverage across the state. Hospitals that receive vaccine shipments will have access to the ultra-cold storage or dry ice required to store the vaccine. Massachusetts plans to work with other hospitals to expand vaccine distribution in the months ahead, and it's critical that hospitals can properly store the vaccine before they accept shipments. If Phase 1 goes according to plan, we plan to start Phase 2 sometime in February. Phase 2 focuses on workers in critical industries and individuals with one or more comorbidities. It then extends to a broader universe of adults that are over the age of 65 who are at a higher risk for COVID-19. During Phase 2, distribution will continue to all Phase 1 groups that I already mentioned. And specifically, in order of priority, Phase 2 is individuals with 2 or more comorbidities who obviously are at significant high risk for COVID-19 complications, workers in early education, K through 12, transit, grocery, utility, food and agriculture, sanitation, public works, and public health, adults that are over the age of 65, and individuals with one comorbidity. Additional shipments of vaccine doses are expected to arrive in Massachusetts throughout January, February, and March. We hope to begin to make the vaccine available to younger and healthier people later in the spring, with an approximate goal of starting in April. As the vaccine infrastructure ramps up, the Commonwealth will make vaccines available in more healthcare settings, including pharmacies, local health departments, and at public health clinics. The vaccine will be provided free of charge to all individuals, and insurance companies will not charge any out-of-pocket costs or co-payments. And as I said earlier, the timeline and the estimated quantities of vaccine available to Massachusetts will depend on several variables. This stage, when the vaccine becomes available to the public under the age of 65, is still months away. It's still too early, and there are too many variables that are still being worked out to say exactly when this stage of the process would get underway, but our estimate is that this segment of the population could start getting vaccinated sometime in the spring. That means two things. We'll have more information in the coming weeks and months on this stage, and we all need to continue to wear face coverings, avoid groups, and work to stop the spread. Members of the public, healthcare providers, and others can learn more about when and where they'll be able to receive the vaccine at mass.gov/COVID vaccine. And we'll continue to update mass.gov with more information on this process as it moves forward. While we know everyone's eager to greenlight the vaccines, obviously safety is fundamental and paramount. The vaccine will not be distributed in Massachusetts until the FDA has approved it for emergency use and it is deemed to be safe. Vaccines go through more testing than any other pharmaceutical, including extensive testing and clinical trials. Again, vaccines will be safe, and no one would distribute them if they weren't. Dr. Bittinger will have more to say on this. The Commonwealth is also committed to an equitable distribution of the vaccine, and we recognize that the pandemic has disproportionately affected communities of color and low-income people. Our Vaccine Advisory Board has been intently focused on ensuring that these voices have been heard during the planning process and included representatives from this community. Communities of color and at-risk populations are prioritized in distribution timelines. And our administration will be focusing intently on reaching these individuals and making clear that the vaccine is safe and effective. We've prioritized multilingual, community-oriented outreach throughout our response to this pandemic, and that will remain true for this process. In a moment, Reverend Liz Walker of the Roxbury Presbyterian Church and a member of our Vaccine Advisory Group will talk a little more about that. Vaccine distribution will be a long process that plays out over several months, and these timelines could change based on production. Massachusetts will continue to work with the federal government to ensure a safe, equitable, and efficient distribution of these vaccines, but there are some elements of this process that will evolve over time, like how many other vaccines will be approved for emergency use and when, and how quickly doses associated with those vaccines will be available to the states. We're going to ask the public to be patient and to get their information from a trusted source. Today, we'll be posting an FAQ, frequently asked questions, and short presentation to explain the timeline and phases for vaccine distribution. And these documents should answer more questions on safety, distribution, and who qualifies in each phase. If you have additional questions on which phase you qualify for, please contact your healthcare provider. I want to thank the public in advance for their patience and their vigilance throughout this process. The availability of a COVID-19 vaccine obviously provides much needed hope and relief for many. In some ways, it does represent the so-called light at the end of the tunnel. But administering a vaccine to one person is a several-week process, and after the first dose, a person must wait about 6 weeks and then receive a second dose. Both the Moderna and Pfizer vaccines take about 6 weeks to provide a person with immunity from the virus. That means that while the first doses will be administered shortly, we're several months away from safely vaccinating a majority of the people of Massachusetts. We are certainly not out of the woods yet, and it's critical that people continue following the state guidance and the preventive measures that so many of you have abided by for the past 10 months.